afternoon, Your Excellency, and welcome to the Sultanate of Oman. We are very pleased to have you here in Oman. Your Excellency, almost 2 years since WHO declared the global spread of novel coronavirus disease, COVID-19, a public health emergency of international concern. The impact of the COVID-19 pandemic has severely challenged governments, health systems, and economies, and has devastated millions of lives and livelihoods all over the world. Your Excellency, as the scale and severity of the COVID-19 outbreak occurred at a lightning speed, you emphasized that the only way to defeat this outbreak was for all countries to work together in a spirit of solidarity, political solidarity, technical solidarity, and financial solidarity. How far have these countries managed to work on that path, and where does the Sultanate of Oman stand today?
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for welcoming me, and I'm really glad to be in Oman, and my greetings to all Omani. I arrived this morning, and I had a very good meeting with His Excellency Minister of Health, Dr. Ahmed Al-Saidi. We had a very good discussion. And I'm really glad to see that the COVID situation in Oman is declining, has declined significantly actually, compared to the situation in June 2021 when it had the highest peak. Now it's close, to nothing compared to that. I mean, the situation has improved very, very significantly, and I'm really glad to see that. And the reason for this is, the application of public health measures, but in addition to that, the vaccination coverage has also increased significantly. And I'm really glad to see, first dose more than 85% was Omani, and also expats, and around 50% for second dose both for Omani and expats. So this is a very good news, and I'm glad to see that Oman is doing very, very well. Then to the question you asked, as you rightly said, I have been calling for solidarity since the first report, because without solidarity we knew this virus could not be stopped. But not only the global solidarity, but national unity also, because the two go hand in hand. Unfortunately, the global solidarity is not as really good as we expected. Especially when vaccines were ready, that's when we saw that the solidarity level of solidarity we expected is not as good as we expected. The solidarity we saw is not as good as the solidarity we expected. And this was because of vaccine nationalism and me first attitude, giving less regard to solidarity. But when vaccines, vaccination started, especially those countries who produce and control bulk of the resources, should have been willing to share, because it's in their best interest. It's only when everybody is safe that they can also be safe. As you know, the whole world is under hostage of this virus, and it's when everybody is safe, then the world can open up. But that's not what we have seen. Although it's not all bad, there are now some positive signals.
Okay.
The positive signals of sharing. There was a pledge, for instance, as you know, from high-income countries to provide 1 billion doses. But out of the 1 billion doses, only 15% is now delivered. Still small, but it's a good step. And I hope, the countries who pledged the 1 billion will help in materializing it.
But
especially if you see in Africa, the coverage of vaccination is less than 2%.
Right, yeah.
While in high-income countries, there is like more than 60% or 70% coverage. This kind of disparity is not will not help us to control the virus. So I hope this positive signal we see now in terms of pledges, although the delivery is still small compared to the pledge, will increase, and we will have vaccines in those who are lagging behind too.
Right. Now, the booster, again, COVID booster vaccine have gained traction in several countries, US, Israel, Germany, UK, and others. But low and middle income countries lag significantly behind this short, as what you have stated there. What is your, what would you like to say about this?
You know, WHO's position is very clear. First of all, the use of boosters, its usefulness, is not conclusive, the evidence we have. 3 weeks ago, we had a meeting of experts from all over the world. More than 2,000 experts have deliberated on the same issue, and their conclusion is that usefulness of boosters is not conclusive. The only area we can use boosters is for immunocompromised. So what we're asking the world is, please stop boosters. And I, launched a moratorium until the end of this year, and we want countries to respect, because, the first and second dose is enough as far as the evidence is concerned.
Right.
We should not go into boosters when others are not getting even the first and second dose. Like I told you, in low-income countries, developing countries, the coverage of the first and second dose is less than 2%. So this is unjust, and I think the world should really refrain from using boosters for healthy people, except the immunocompromised.
Now, many countries are preparing now to send their children to schools, including Oman, where they are going to send their children to school. Now, we know the vaccine is from age 12 and above, you can have it. In some countries, initiatives are already underway to vaccinate young children as young 2 years old. Cuba is one example. What are your views on these initiatives and its significance, if any?
Our position on this has also been very, very clear, to vaccinate those at risk, the most vulnerable.
Right.
And those, certain age groups with comorbidities, health workers or other professionals, because of their work, are at risk. So we expect countries to follow that, but as you know, that's what we said also, the problem with solidarity. We see some countries doing something different, which is not helping the solidarity.
Finally, how do you see the this particular complex here? You've seen the vaccines process and other. What would you like to say on that?
This is a very modern exhibition center, and it's converted into vaccination center, and the process is incredible. Someone to have a vaccine here can go through the whole process in 15 minutes.
Indeed.
And they vaccinate in this center alone more than 10,000 to 12,000. And the good thing is the identifier number they use here is linked with the national, and that also helps in who is getting it and track who is not. And the whole setup is very attractive also. It doesn't look like you're in a vaccination center, but in an exhibition to look around. So it's well organized, and I would like to congratulate Minister Ahmed Saidi, Ma'al and also the whole government for this commitment, and also to the people of Oman. It's one government and people work together that you can see this kind of success. So all the best to Oman.
Thank you very much.
I have one more question. Speaking about solidarity, we have seen the fair distribution of vaccines. We have seen some countries that have booked quantities of vaccines that really exceed their actual needs. Does the organization has a plan for the future that guarantees such a thing won't happen?
So we're asking even now to do a kind of swap. So they have vaccines, then they have to swap. If this vaccine is needed for them, it can be, they can get it some other time and give what they're hoarding now to others. So that was one of the recommendations I made actually 2 weeks ago in my presser, and also during the G20 meeting in Rome, to swap, so those vaccines that are being hoarded are made use of.
Your Excellency, thank you very much for your time. If you have a final talk of conclusion, you feel free, please.
No, thank you. Shukran for this opportunity. And again, my greetings to all people of
Once again, we're very happy to see you here, and we wish you all the best with your mission. Thank you very much.
مع السلامة.
مع السلامة.